Hello friends, myself Professor Sanjay Purohit. I would like to extend a warm welcome to you on my YouTube channel. I would like to thank everyone who has subscribed my channel and encourage you to do so if you have not already subscribed it. Please subscribe it so that you will get a new video notification earliest. Friends, today we are going to talk about management of Pervious Urachus in cows. In clinical procedure series, this is my 7th lecture. Friends, urachus is a fibrous cord that arises from anterior wall of urinary bladder and extend cranially to umbilicus. During prenatal life, urinary bladder communicates with allantois through a structure known as urachus, which become atrophied and its lumen get cicatrized after parturition. Friends, when urachus does not close, that condition is known as persistent urachus. Or urachus close and reopen at later date. That condition is known as patent urachus. Friends, urine continue to leak from the umbilicus in this condition. This condition is commonly known as Pervious Urachus. See this picture. This is the urinary bladder. This communicate through the urachus to the umbilical stem. This structure is umbilicus. Now we discuss about some etiological factors. Friends, failure of urachal involution, neonatal tonsillitis, umbilical abscess, congenital urethral obstructions are some common cause of Pervious Urachus. Now we discuss about type of Pervious Urachus. Pervious Urachus is of two types. It may be congenital or it may be acquired. Congenital Pervious Urachus present at birth, while the acquired Pervious Urachus generally develop in first 2 weeks of life. Now we discuss about congenital Pervious Urachus. Friends, urachus never grows at birth. In this condition, due to distension from cord torsion in utero or during delivery, leading to tension of umbilicus, dilatation of urachus, and preventing occlusion or incomplete urachal involution. Friends, congenital Pervious Urachus often accompanied with other congenital abnormalities. Now we discuss about acquired Pervious Urachus. Urachus reopen postpartum as dried of umbilical stem hollow. This is associated with umbilical infections and inflammation. Any cause of increased intra-abdominal pressure, that is meconium retention, that cause tenesmus, dysuria, etc., cause acquired Pervious Urachus. Excessive wetness or trauma to the umbilical stem. Prolonged recumbency in case of the regulated cows is also caused acquired pervious urachus. Friends, urine leakage in persistent urachus or urachus pervious cause persistent irritation and potential source of infection. Urachal wall is thinner than the urinary bladder wall. Hence, urachal wall is more prone to rupture. Spread of infection to intra-abdominal organs. Ascending infection can affect the urinary bladder. Friends, the Pervious Urachus condition is more commonly observed in whole cows and buffalo cows. Usually, Pervious Urachus is accompanied with omphalitis, omphalophlebitis, urethritis, uroperitoneum, cystitis, umbilical cord infection, urinary obstruction. Now we discuss about clinical sign. Friends, dribbling of urine from umbilicus is seen, also present in this picture. Wetting of the area around umbilicus, thickening of umbilical cord, local area around umbilicus is inflamed, edematous, and pain on palpation. Caudal to umbilicus, a hard cord-like structure should be palpated. See this picture. Now we discuss about diagnosis. Friends, in veterinary practice, diagnosis of the Pervious Urachus is based on history, clinical sign, radiographic examination, and ultrasonographic examination. So first we discuss about the history. In history, the dribbling of the watery fluid from the umbilical region is reported by the owner or observed by the owner. Clinical sign: a hard cord palpated, swelling of region, dribbling of the urine. Urine comes from umbilical region. Whenever we press the urinary bladder, catheter may pass into urinary bladder through the urachus. Radiographic examinations. In radiographic examination, lateral abdominal radiograph showing the presence of metallic catheter within the urinary bladder with entry point podoventral borders. See this. Ultrasonographic examinations. In ultrasonographic examinations, urinary bladder appear as black, that is the anechoic structure due to presence of urine. This one is urachus, persistent urachus. The lumen of urachus contain fluid appear as an echoic structure. So friends, patent urachus are traced in cranioventral portion of the urinary bladder. See this structure. This is patent urachus. Differential diagnosis from abscess, umbilical hernia, urethral carcinoma, cyst. Now we discuss about treatment. Friends, ascertain the condition of urethra before initiation of treatment. Urine should dribble from urethra, means natural orifice. Two types of the treatment options are available: conservative treatment and surgical treatment. First, go for conservative treatment. If conservative treatments are not fruitful, then we should shift on surgical treatment. Conservative treatment. Topical intraurethral cauterization should be performed using blister around the orifice, using phenol dipped cotton swab over the urachus, or we can use silver nitrate or other cauterizing agents. Hence, we can use needle point firing, or we can blindly ligate the urachus. These are some conservative options available. If conservative treatment is not fruitful, then we should shift on surgical management of pervious urachus. For this, the calf should restrain in dorsal recurrency. Surgical site on the mid-ventral abdomen around the umbilical region should be prepared for the surgery by the shaving, then scrubbed with povidone iodine solution and properly wrapped. Hence, this surgery should be performed in cranial epidural anesthesia, or we can use local infiltration anesthesia using 2% lignocaine hydrochloride solution. About 10 cm long elliptical incision on the skin is made around the umbilicus. Incision is deepened to enter the peritoneal cavity. Code of Pervious Urachus should be identified. Urachus raised to the bladder and doubly ligated close to the bladder using number 1 polyglaptin 910. Then the same should be resected. Abdominal cavity should be meticulously explored to rule out any concurrent abnormalities and presence of adhesions. Abdominal muscles should be closed using overlapping meta-suture patterns using silk. Subcuticular suture pattern using number 1 polyglaptin 910. The skin should be closed using nylon or polyamide suture materials. Calf immediately start voiding urine through external urethral orifice. Postoperatively, antiseptic wound dressing regularly using povidone iodine solution. Antibiotics for 5 days and analgesic for 3 days should be administered. Skin sutures should be removed on 12th postoperative day. Postoperative complications, if any, should be managed accordingly. Animals generally have an uneventful recovery. Prognosis of Pervious Urachus condition is grave when the urethra is permanently occluded. If the urachus remain open for the longer period, it may act as source of ascending infection to urinary bladder. Friends, based on today's lecture, we designed some questions for you. You are requested to solve these questions. At the end of this video, the answer of these questions are provided so that you can check yourself. To start, please. Question number 1. The most common congenital condition of the urinary bladder is A. Urolithiasis, B. Pervious Urachus, C. Cystocele, D. Tumor. Question number 2. The congenital condition that result in urine dribbling from the umbilical region is called A. Persistent urachus, B. Patent urachus, C. Pervious urachus, D. All above. Question number 3. During prenatal life, urinary bladder communicates with allantois through a structure known as A. Ureter, B. Urethra, C. Urachus, D. All above. Question number 4. Conservative treatment of patent urachus is option A. Application of blister around the orifice, B. Needle point firing, C. Application of phenol, D. All above. Question number 5. Patent urachus is generally observed at A. 1 to 2 weeks of age, B. 1 to 2 months of age, C. 1 to 2 years of age, D. All above. Now this is answer time. Please check your answer. Question number 1, B. Question number 2, D. Question number 3, C. Question number 4, D. Question number 5, A. Thanks for watching this video. If you have any doubt, please see this video again and again. If you have further any doubt, please comments me. I will reply.